Hi there, everyone. Gary Bronz here from the National Kidney Foundation. I'm so happy that you can be with us today for another edition of the National Kidney Foundation's NKF Live series. So the subject of today's discussion is called chronic kidney disease-associated pruritus. Those are pretty big words. It basically just means itching. And for today's discussion, we're going to focus on the itching that typically affects folks that are living with kidney disease or are on dialysis. So I'm very happy to be joined today by Dr. Tariq Shafi. Dr. Shafi is the Director of Nephrology Department at the University of Mississippi Medical Center. Dr. Shafi, thanks so much for being with us.
Thank you so much. Pleasure to be here, and thank you to National Kidney Foundation for organizing this program.
Of course, I appreciate you saying that. I'm also honored to have with us today Dawn Edwards. Dawn is currently on dialysis and has been experiencing the itching that typically comes with it, right, Dawn?
Yes, I have, and thank you so much for having me, and thank you to the National Kidney Foundation as well.
Well, I'm glad that you guys are here. And let me ask you, Dr. Shafi, just set the stage for us. What are we talking about here, this itching issue?
Yes, so we're talking about CKD-associated pruritus, which is a general sort of term that we have started to use with itching that is experienced by patients with kidney disease, including those with very advanced form of kidney disease requiring dialysis, but also otherwise as well. This itching is different from the common type of itching that most of us have experienced, for example, after a mosquito bite, and you have an itch. And then this form of chronic itching generally tends to be more persistent, tends to come on at various times, and there doesn't seem to be a clear factor that is bringing it on.
Is it common?
Yes, actually it is surprisingly common, and it is something that people with advanced kidney disease suffer with silently. So the statistics show that people with kidney failure that are actually requiring dialysis, almost 80% of them, so 8 out of 10 have some form of itching, and about half of them, so 1 out of 2 people would have severe enough itching that actually interferes with their activities of daily living, mood, and quality of life.
Okay, thank you. Dawn, we've been talking. I know that you have experience with the issue. Share your story. Tell us, why are you sitting here with us now?
Well, it all started 32 years ago. I was 23 years old, and I was diagnosed with end-stage kidney disease and requiring dialysis. And I would say after I was diagnosed, later in the stages, right before I started on dialysis, that's when I noticed that I was having more itching than normal. And I thought that it was something that I could take care of myself by showering more often, applying more different types of lotions and creams. And after it became more persistent, particularly when I started on dialysis, it became more persistent. And that's when I discovered that I needed to talk to my doctor about it.
Okay. Dr. Shafi, why does it happen? Do we know?
Yes, so it's a complex problem that patient experience, and there's a combination of things, including some things that people may experience even if they did not have kidney disease, and then specific things that happen as a result of kidney disease that can lead to this type of itching.
Okay. So there's not one specific thing that's causing this, right?
So it's not one specific thing that's causing it, which also then leads into the difficulty in managing it.
I see. Was there anything for you? Did you notice anything particular that caused it, or yeah, did it happen to you when you ate something, or when you used a certain type of product or anything like that?
See, Gary, that's the problem. There is no specific thing. This type of itching, it feels like you're itching from the inside out.
Okay.
So it's not particularly after eating. I did notice that it was more persistent at night. However, it wasn't any one particular thing that I would say caused it. One of the things that was particularly disturbing about it is when I did speak to my medical team about it, it was almost like you were patient shamed. So it was associated with a high phosphorus level.
Okay.
And even if the phosphorus was within the normal or the target range, you still got that your phosphorus is out of control and maybe you should stop eating this or stop eating that. You should watch what you're eating. And that's a particular thing that it's a medical thing, you know, and it pretty much shames patients into feeling that it's our fault.
And you talk about that, I mean, phosphorus, now you're getting into a whole other thing where you have to start paying attention to that. And I know a lot of patients are not really attuned to those kinds of things. I mean, the word phosphorus, a lot of people don't even know what that is, and what the numbers or the levels are supposed to be, right? So it's that's a tricky, you know, you're going down a slippery slope, I guess.
Yes, I think it's actually a really important point here that, you know, phosphorus control is really important. We know that for a variety of different reasons, but you know, studies after studies have shown that phosphorus and itching are not really related to each other. So, you know, yes, the phosphorus needs to be controlled for a variety of reasons, but, you know, if somebody has itching, we really need to sort of think of other reasons that the itching may be there and not just blame phosphorus for everything that is going wrong.
Okay. So in terms of what you can do about this, like I'm sure a lot of people watching, they don't want to watch 30 minutes of us talking about our stories and then, you know, they want answers, because I know if I was dealing with this, I would want to know what to do about it. Are there things that you can do about it? Either one of you guys, go for it.
Well, I know for myself personally, I tried everything that was possible. I was told to take cooler showers instead of hot showers, so I tried that. I tried a variety of different lotions and creams, and, you know, all to no avail. And finally, what helped me, and I'm not saying that this is everyone's, you know, everyone's cure or solution, but when I did start to do home dialysis, and I was getting those dialysis treatments more frequently, I noticed that I started to feel better, not only with the itching, but an overall better sense of well-being.
Okay. Are there some general things that, as a doctor, you would typically recommend?
Yeah, there's many general things that actually can be done that that can help with itching that, you know, we would recommend even for people without kidney disease. So these are some general skin hygiene things, starting off with making sure that the skin is not too dry. And this is really important because as we grow older, our skin tends to get drier, and especially in colder weather with heat, there's more drying out of the skin as well. So use of a high quality moisturizer to keep the skin moist, especially in areas that are affected by itching. So that's the number one thing that's really important. The other two things are related to taking showers and also how to dry the skin. So the natural tendency is for people to take a shower and then dry it and rub the skin off and exfoliate and other things that we hear about. But with one of the things that happens with aging is that there's a fat layer on the skin that actually starts to get thin. And if you take a shower with hot water, that can tend to wash it off. And also if you rub yourself dry really hard, it can actually also cause breakdown of the skin as well.
So people should avoid hot water during
extremely
the shower.
hot shower, and then you know, pat yourself dry instead of rubbing with vigorously with a shower.
I'm sure people love the idea of having to take a cold shower now, but
right. And well, not a cold shower, but not an extremely hot shower as well. And I think also the other thing is that, you know, sometimes with itching, you really want to actually take the towel and rub yourself with it, and that's one of the things you actually want to try not as much to do. And I think the third thing is that, you know, one of the problems with itching is that it's a reflex that makes you scratch. And the scratching and breakdown of the skin then leads to further itching. So trying to break that cycle is important.
Well, it feels good when you scratch it, right? But what you're saying is you're not helping yourself.
Not helping yourself doing that.
Okay. I know we were talking earlier about, and you probably do this better than anybody I've ever spoken to with the issue, is advocacy. Advocating for yourself, I should say. You know, speaking up. A lot of people probably don't associate the itching with the other medical conditions that they may be experiencing. So, you know, any advice for what people should do in terms of speaking up? Who do you reach out to? Is it the social worker in the dialysis unit? Is it a clinician? Is it somebody at the pharmacy? Who do you talk to? Other patients?
That's a great question, Gary. You know, I always tell patients, and this is something that I learned from my own experience. I've had kidney disease for over 32 years, and one of the things that I learned is you have to speak up. It's the worst thing that you can do for yourself to suffer in silence. So talking to your social worker about itching, that's not the right person to talk to. It's really important for patients to learn and know who to talk to in the care team about what. You want to talk to your social worker about things that you talk to the social worker with. If you're having problems at home, if you need food stamps, that's your social worker. You want to talk to your dietitian about things associated with your diet. But if you're itching or if you're having some type of physical impairment or something that is interfering with your day-to-day life, you talk to your nephrologist, you talk to your doctor. And if you don't know how to do that, you talk to any member of your care team, and they will help you to find ways to speak to your doctor.
Right.
But the most important thing is not to suffer in silence, to advocate for yourself, and to speak up. Don't just keep it to yourself.
Okay. So I've been with the National Kidney Foundation for a long time. This is a relatively new issue to me. Is this something that you would typically mention to your patients, that they may experience this? Is it something that, you know, we talked a little bit earlier, like there are certain things that you mentioned, listen, you may feel this, you may feel that. Is this something that you would bring up with them normally?
Yeah, so itching is one of the things we generally tend to, as physicians, tend to ask patients about as the kidney disease is advancing, and especially as they are getting close to dialysis initiation. And as part of our training, we are trained to ask about certain symptoms of advanced kidney failure, such as loss of appetite, nausea, vomiting, itching, and altered mental status or sleepiness. So people are very used to asking those questions at that time. Now, after people have started dialysis, this is a question that is actually asked as part of regular surveys as well. But unfortunately, it's not one of the questions that is asked routinely of patients too. So I think from the physician's standpoint and provider's standpoint, it is not really part of the routine questions that is asked.
Yeah. Is that changing at all?
I think it's changing. There's been exciting developments with new therapies that have come along, and along with that, people have started to become more aware of this problem and have started to discuss it as well.
Okay, thank you. Let's talk a little bit about lifestyle, because again, we were talking earlier, and I would imagine that this would affect a lot of things that you do in your life, whether you're cooking for your family, whether you go to the gym, maybe sleeping. Can you talk a little bit, Dawn, about how it affected your lifestyle?
Yeah, absolutely. I can just say from my experience, it's embarrassing. Itching is something that everyone experiences from time to time, but when you have it to the extent that a kidney patient has it, where it becomes chronic or something that you find yourself doing all day, that becomes socially unacceptable. And you tend to internalize it. So when you're scratching all the time, you kind of avoid social situations because you're embarrassed about it. You know, you may think that others may think that you have a drug problem or that your hygiene is not up to par.
Right.
So it can be a real lifestyle, like a black eye on your lifestyle.
Sure, which I assume would lead to mental health issues or psychological issues that, you know, if you're avoiding doing things that you would normally do or that you enjoy doing, that could be a problem.
Yes, absolutely. It can be really socially damaging, and it has a big hit on your self-esteem as well.
Okay, but for you, you said that this typically occurred later in the day, right? Or maybe even when you were going to sleep?
It was more persistent, I would say, in the evenings and at bedtime. But just to be completely honest, you can be scratching all day.
Okay, okay. Let's turn to the audience here and see what type of questions they're sending in and see if we can address a few of those. So that's what I'd like to do at this time, is take a look at some of those questions that folks have been asking on Facebook. I'll remind you that in the event that we don't get to your question, just post them in the comments section. We're going to do our best to answer as many as we can. If we run out of time, I promise you that all the questions will be addressed on our NKF's Facebook page after the program. So let's see here. We have a question from Ryan in California. Ryan is asking if when would be a good time to see a dermatologist?
Yeah, so that's a really good question. And
a dermatologist, just so for the folks that are wondering, is somebody that deals with skin, a doctor that looks after your skin, correct?
Right. So dermatologist is a skin specialist, just like nephrologist is a kidney disease specialist. So that's a really good question. And I think one of the things with the issue with itching is that it does need a full sort of evaluation in terms of what is going on with the patient. So if I'm evaluating somebody with itching and they have unexplained skin ulcerations, meaning they have open sores on the skin, they have bumps, or something else that's going on, if they have some other diseases where I may think that these internal diseases may actually be causing the itching, then that's definitely a reason to see a dermatologist. There are certain types of itching in people with kidney disease that we think are immune mediated, and some of those may actually benefit from light therapy. And if that's one of the situations that somebody has, that's another reason to send somebody to a dermatologist as well. And then I think finally, if both from the provider perspective and the patient's perspective as well, if we do not have if I do not really have the answer to a question that my patient has, or if the patient does not have the answer from the provider, they really need to seek out somebody else to get to the bottom of the problem.
Did you see a dermatologist?
Actually, I did. I saw a dermatologist and I was prescribed various lotions. And I was always told not to let the skin get dry, like Dr. Shafi said. After taking that shower, instead of rubbing the skin, to pat it dry and to always moisturize. And I noticed that during my experience on dialysis, that after dialysis treatment, that's when my skin was the most dry. And that's when I knew that I needed to apply more moisturizer. So sometimes during the course of the day, it's also a good practice to stop during the day and moisturize so that your skin is not getting overly dry during the course of the day. We have a chronic disease, and most people take a shower in the morning, they moisturize, and that's it for the day. But with a dialysis patient or someone with chronic disease, we have to pay a little bit more attention and give ourselves a little bit more tender, loving care.
Yeah, okay, good advice. This question is from Kathy in Westport, Connecticut. Kathy wants to know, when in the course of the disease is this issue most prevalent? I think what she's saying is, people have different stages of kidney disease. As it progresses, is there one point where you find that this is more of a problem?
Yes, that's also an excellent question. And, as I alluded to earlier, that people with advanced kidney disease that is requiring dialysis tend to have this severe form of itching, and it is very common. But what we are also realizing is that even in the earlier stages of kidney disease, people actually also experience itching, and it may not be as common, but they still have it. So we typically divide kidney disease into 5 stages, with 5 being advanced kidney failure, 1 being the early stage. So typically after stage 3 or so, which is where your estimated GFR or GFR is less than 60 ml per minute, people start to get some symptoms related to kidney disease. And some of the studies have shown that if you take everybody with an estimated GFR less than 60, 1 in 4 people will have moderate to severe itching. And of the remaining people, 1 in 5 would probably, or 1 in 4 would actually get moderate to severe itching in the next 4 to 5 years or so. So even in that population, it actually is quite common.
Okay. Did you notice a difference from when you first started with kidney disease? Was it worse at any point throughout this journey?
I would say going more towards dialysis. I had slight itching in the earlier stages prior to dialysis, but I didn't pay any attention to that because as far as I knew, I didn't have kidney disease.
Right.
But once I started on dialysis and I was going to treatments 3 times a week, that's when I really noticed it, especially when I was receiving dialysis treatments. So I actually did speak up and I complained about it. And at that time, they were giving Benadryl during dialysis treatments. Later on, they stopped doing that. And it was up to me to either bring my own Benadryl or talk to my doctor about it. So that's where we go back to that advocacy for yourself piece.
Right.
You know, you have to speak to someone about it. It's not just because you didn't take a shower or because you know, there's something wrong with your hygiene. There comes a point in time when you have something going on with you that you can't explain or you don't know how to deal with, or it's interfering with your quality of life, that you speak to your care team.
Okay. Chloe from Portland, Oregon wants to know if there's a specific time of day. We touched a little bit about this, but do you notice, Dr. Shafi, if there's a specific time of day that most people find themselves dealing with the issue more than other times?
Yes, so since it's such a mix of different issues that cause the itching, and actually also going back to Ms. Dawn's comment about dialysis, you know, there's certain, in the past, there's certain dialysis membranes that we used to use that actually would cause some sort of allergic reaction in people, and they would have itching, and that would require Benadryl therapy as well. And that has changed. The dialysis membranes have improved. So most of the times when people experience dialysis, experience itching when they're on dialysis, is not really related to the dialysis treatment itself. So it really can happen at any time. It can happen during the day, during the night time, you know, while they're on the chair, or at other times as well. But it actually is really helpful to for people to think of when this may be happening. For example, if they notice that their itching is starting to happen more after the long dialysis interval, so you know, on Tuesday or on Monday, maybe it is related to blood not being clean enough, and maybe they would benefit from more frequent dialysis.
Right.
Whereas if it's happening during sleeping, maybe it is related to, you know, something like the detergent on the bed sheets.
Okay. That's interesting. Yeah, I didn't even think about that. Did you have any experience with that at all?
I thought of everything.
Yeah.
You know, I've been on dialysis for such a long time, and I've dealt with this issue intermittently during the course of my, you know, my dialysis journey.
You're doing in-center or home dialysis?
Well, now I'm a nocturnal home hemodialysis patient.
Did you notice a difference from when you switched over from?
Absolutely, Gary.
It was better?
Yeah, I'm not a clinician and I'm not giving medical advice, but from my perspective, when I started doing more frequent and longer, slower dialysis treatments, I started to notice a relief from a lot of my dialysis fatigue and all of the other symptoms that I used to suffer with when I was on 3 times a week dialysis.
Is that typical, do you think, Dr. Shafi?
Yeah, I mean, most of the times when people are on longer or more frequent dialysis, they tend to do better just because our kidneys work 24/7.
Yeah.
Yes.
And the dialysis is so infrequent. And 3 times per week dialysis is the absolutely bare minimum dialysis that we can do to survive.
Okay.
So I think, you know, many people would share the same experience as yours, where they would actually have less symptoms of many different types while they're on more frequent dialysis.
Okay. So I'm just thinking about timing here. We're running out of time. Do you have any final messages for folks that may be watching this that you want to kind of put out there?
Yes, I think, you know, from a provider perspective, I would really like to say to the patients that, you know, if you have itching, if you have these symptoms, do talk to your provider. And I understand many times talking to the doctors can be intimidating, and sometimes, you know, they may not answer the question right away. And if that's the case, talk to your care team, talk to the nurses, talk to the social workers about how best to approach this problem. But don't give up on it.
Yeah, okay. Dawn, give you an opportunity to sort of take us out here. Do you have a message for folks that are watching, whatever it may be?
Yes, you know, I just want to say that as a patient, I know that kidney disease is not, it's not unicorns and rainbows. It's a tough journey. Every day is not going to be the same. We suffer from many different things. But I just want to say, from someone who has done this, I've been there and done that for 32 plus years. And talk to your care team. The most important thing that you can do for yourself is to advocate for yourself. Speak up, have that relationship with your care team, whoever it is, and don't suffer in silence, never suffer in silence, and always stick up for yourself and speak up.
I think that's a great message. Thank you so much. So what I'm taking from this whole thing, it sounds to me like there's no magic pill. We didn't come up with a solution in 2 seconds and say, look, there's things that you can do about this. It sounds like everybody has a little bit of a different experience, but it's pretty common. And I think you're right. Advocacy is certainly a great place to start, to just, you know, reach out to somebody to help, because there are things that can be done. May not work the same for some people as they do for others, but there are some things that can certainly help the problem, correct?
Yes, so there's no magic pill, but you know, we know that with appropriate treatment, half the people may actually get better. So yes, it's definitely
okay, well that's encouraging. So I'm really sorry to say, but it looks like we're out of time. And we're just scratching the surface. I'm sorry, I just had to say that one. So I remind you that in case we didn't get around to answering your question, please check on the National Kidney Foundation's Facebook page. We will be posting the answers throughout the coming days, so you can check there. You can also always, and we encourage you to please contact the NKF's helpline. The number's been shown throughout this program, but once again, the number is 855-NKF-CARES. That's 855-NKF-CARES. I want to thank our sponsor, CSL V4, for their generous support in helping make this program possible. We also have on our website, V4 was kind enough to sponsor an entire page of information about this issue. You can go to our website and just simply type in itching or itch or pruritus, and you will get a bunch of information up there. So I encourage you to do that. I would especially like to thank our guests today, Dr. Shafi, Dawn. Thank you so much for joining us. Really appreciate lending your stories and your expertise to the issue. And you're both so helpful, so thank you again.
Yeah, thank you.
Thank you.
And now, on behalf of the National Kidney Foundation, until the next time, I'd like to wish you all good health.